Hi there. How are you? I hope you're doing well. If we've not met before, I just want to introduce myself. My name is Dr. Karen Trainer, and I am a veterinary pathologist and the founder of Innovative Vet Path. And I'm happy to be meeting you today, and we're going to have fun going through a case called from a cat by the name of Toby. And he has got a lesion on the ventral abdomen of his on his belly, and we'll go through some clinical pictures, then we'll go through the histopath findings, and we'll discuss all of that. So I'd like to share that with you, and we'll get started. So just to get things rolling, these are some of the clinical photos from Toby, and just to introduce you to his case. He is a 13-year-old male neuter domestic short hair, and these are clinical photos that were provided by Dr. Dory Stricker. And we can see here there's a lot of erythema, perhaps some alopecia on the caudal ventral abdomen, and extending a bit medially onto the thighs. So the history for Toby is that in late February, he presented to the ER for a large wound on the ventral abdomen with draining purulent material. According to the notes from the ER, the caudal third of the ventrum, the medial thighs, all the way from the hocks to the inguinal region, demonstrated moderate to severe erythema. There's matting of the fur, 2 to 3 coalescing patches of alopecia. And it was interesting to note that they described it as shiny skin, just cranial to the pubis. And there was no flaking or any obvious discharge at that time. On the left hind limb, they also noted on the caudal aspect of the hock, there was a small active bleeding wound. So a lot of information to take in here and process. There are 3 main differential diagnoses for lesions on the caudal ventral abdomen in cats. And they are, there's a few different elements of the history and the clinical appearance that go into ranking those, and in addition to features that we'll find on biopsy to help sort those out. And we'll talk through those as we go. So as far as the clinical history, while he was at the ER, they did impression smears and found 3+ cocci. They found a lot of neutrophils, including increased eosinophils on the cytology. And what was interesting to note, and this could just be a red herring, but the owners had just described that they had had the hardwood floor sanded and restained and thought it could be a potential contact dermatitis. So the cat was sent home on ceftriaxone, Enterderm, and Onsior. After that, he presented to his general practitioner for a recheck after that ER visit. And on physical exam, the GP found that the ventral abdomen was still alopecic, although they noted that the cat was shaved while at the ER, and that there was moderate erythema extending all the way from the mid-thorax to the medial aspect of both hind limbs. So underneath the fur, they made a very important observation. They noted from the mid-caudal thorax that there are some dark red, purple patches of skin. So now we're getting some mixed signals here, and they also noticed some occasional patches of shiny skin along the alopecic areas. So they did some more workup. They did some skin cultures and identified Pseudomonas, Enterococcus, Staph aureus. And the 3 main differential diagnoses to consider for lesions on the ventral abdomen of a cat include atypical mycobacterial infection. This can occur in cats of just about any age, but they typically have a history of being indoor-outdoor cats or being indoor and living with other cats that perhaps they don't have the best relationship with. So that there could perhaps be some intra-cat aggression and seeding of atypical mycobacteria into that ventral abdominal fat pad. All right, so it's good to know that Toby is an indoor-only cat, and to the best of our knowledge, does not live with any other cats in the household. So that helps us to to put that one further down on our list of three main possible differentials. The other two differentials that we consider are paraneoplastic alopecia and then ventral abdominal angiosarcoma. So the ventral abdominal angiosarcoma tends to have a lot of oozing with that, but it has a very characteristic appearance and a type of drainage. And what was interesting here was that there's multiple reports of the skin having a shiny appearance and with the alopecia on the caudal ventral abdomen. And this is an older cat. So it seemed prudent at the time to recommend abdominal ultrasound, and that was performed on the 24th of March. And those findings were inconclusive, which can often be the case. They were suspicious that perhaps maybe there was some severe pancreatitis or lymphoma, but it really wasn't definitive. And it's important to note now that at this time, there was a large amount of moist seepage that was noted from the skin and included some bleeding from the mid-abdominal skin. So now this is starting to make ventral abdominal angiosarcoma move higher up on the list of differentials. So next step is biopsy to really figure out what's going on here, because we did get culture growing a whole bunch of different things. We do have an older cat that is indoor only. So there are also descriptions of this sort of shiny appearance, but I would note that this is very moist. And with ventral abdominal angiosarcoma, you can get oozing and seepage of serosanguinous fluid, even blood. The abdomen often has a somewhat bruised appearance, and we do see this erythema, reddish, almost purplish discoloration here to the skin. So my leading differential diagnosis at this point with that additional history was ventral abdominal angiosarcoma, but biopsy is the best way to confirm and really make sure that that's what we're dealing with. So I'll pull up the biopsies. Let's switch out of this, and we've got our images here. There were 3 slides, all multiple punch biopsies. The clinician did a fabulous job taking multiple punches. All 3 slides have very similar features, so we're just going to focus on this one since it's got all the main things that we're looking for. So starting at the top and working our way down, we see that the epidermis is intact, but it is perhaps slightly thickened for ventral abdominal skin. Normally in the inguinal area, the epidermis tends to be very thin, even when it's normal and healthy, and this does seem a bit thicker than usual. What we also can appreciate is all of this excess clear space and extravasated erythrocytes. Remember how red and dark, almost dusky purple the skin appeared? That would be because we're seeing all of these extravasated erythrocytes, hemorrhage here in the dermis. And then what's also interesting to note is all of this clear space. What is going on here? So at first glance, it could be easy just to say, oh, those are dilated lymphatic vessels. And in a sense, that is correct. But if we take a bit closer look, these open structures are lined by so many of these plump endothelial cells that are bulging into the lumen. And they're also lining these collagenous, this collagenous stroma, and they're forming blind ending trabeculae. That's what these are called. And if we look around, we see how plump these endothelial cells are. Sometimes they're described as turtles on the shore, which I think is a lovely description for them. They're just sort of resting, and you can see like a turtle shell just bulging into that lumen there. And then what's interesting to note is how sparse. So here's a blood vessel with erythrocytes in the lumen, and another, one more. Here we go. We're seeing them now. But what to make of all these clear spaces that are have very sparse erythrocytes in those spaces? what to make of that? Typically, when we see very low numbers of erythrocytes and clear, sort of somewhat vascular channels, we start thinking lymphatics. So lymphangiomatosis, lymphangioma, lymphangiosarcoma start to become differentials. But cats are very special, very unique. They do their own thing. And this particular entity is called ventral abdominal angiosarcoma, sort of splitting the difference between, well, is this from blood vessel origin, where there is a basement membrane intact beneath those endothelial cells, or is this from lymphatic cell origin, where there is no or inconsistent basement membrane beneath those endothelial cells? Transmission electron microscopy, TEM, is a great way to look for the basement membrane, but it's not something that's routinely done on normal diagnostic biopsy samples, perhaps more in a research setting, or if it's for publication, that's an option that might be pursued. So there are also immunohistochemistry stains. CD31 will light up these endothelial cells, but factor 8A is one that will light up blood vessels in particular, and LYVE-1 is one that is used to detect lymphatic endothelial cells. So it could be a bit of semantics, but when we see these vascular channels with so few blood vessels, and we happen to know that this is a cat and it's from the ventral abdomen and involving the medial thighs, and it's oozing some serosanguinous fluid and even some blood, we can feel pretty confident going along with the diagnosis of ventral abdominal angiosarcoma. So what's also interesting about this lesion is that you can get mixes of inflammatories interspersed and peppered throughout lesions. So if we look closer, we see, okay, plasma cell, plasma cell, plasma cell. We get maybe some lymphocytes. Of course, they go together like peanut butter and jelly. So we get a mix of lymphocytes and plasma cells, a nice Golgi ghost right there in that plasma cell. But then we also have, sometimes we can get infiltrated neutrophils. We can get other cell types mixed in, even the occasional mast cell or eosinophil. What we're seeing right here is a macrophage that has ingested an erythrocyte. So we have erythrophagocytosis at work here. Here's a nice cluster of neutrophils mixed in. These are a couple of mast cells, more erythrophagocytosis. And then these blood vessels have somewhat of a wispy appearance to them when they are interspersed throughout. But what I want to show you is how these vascular channels, these clear spaces, extend all the way from the superficial dermis. They keep tracking down through the dermis, deep, 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 very deep, still going, and now we're down to the muscle, and it's even infiltrating the muscle. This is a very aggressive tumor. While there's not what I would not describe this as marked anisocytosis and anisokaryosis. I would put this more at mild to moderate. There's not a ton of mitotic activity. You can certainly find mitotic figures here and there and some mixed inflammation all throughout. But the mitotic count is not off the charts. It's not something that's usually a terribly striking feature, but all of these are all blind ending trabeculae. And that is bad news bears. So we look at this, and then we also look at these hair follicular structures, because we're not seeing any sheets of pyogranulomatous inflammation as we would expect with a mycobacterial infection, nor was that cultured, but of course that's a very difficult agent to culture. It's extending into the panicculus. But look at our adnexal structures. We can see anagen hair bulbs. We can see that the hair follicles are well represented. We can see sebaceous glands. So we're not appreciating any significant follicular atrophy as we might expect with paraneoplastic alopecia. But look at this. This is so interesting. So this is the tumor, and these vascular channels or lymphatic type channels And they're intertwining, interdigitating in and around and encompassing and engulfing these adnexal structures. So I did wonder if in this particular case, this was somehow contributing to some of the alopecia. Plus, I imagine this lesion is very uncomfortable for this cat and that there's probably some self-induced trauma and licking. We do see some breakage of hair shafts and we can see that. So there is some self-induced trauma, and probably that's where some of the pyoderma is coming from. That is something that we occasionally see in this case. So going back to our slides, I just wanted to share some still images that I took from some of the other slides. And just again, you can see this tumor extends all the way from the superficial dermis deep into the subcutis and down into the muscle. It's a very highly infiltrated neoplasm. And again, if you were to get perhaps just a more superficial biopsy, if it didn't go deep enough where you have all these blind ending trabeculae, it would be quite easy perhaps to miss this diagnosis. So getting really good biopsies, getting sufficiently deep biopsies, or perhaps even considering a double punch technique or a wedge technique, perhaps. We're seeing these nice anagen hair bulbs. So we're not seeing the typical features of paraneoplastic alopecia. We're not seeing any evidence of mycobacterial infection. And those are our two other primary differentials for lesions on the ventral abdomen with any sort of drainage, perhaps. But really the paraneoplastic alopecia doesn't, that tends to be more dry and truly would probably not be associated with drainage very much. So we also see, again, just a closer view of these blind ending trabeculae with some scattered inflammatory infiltrates. And again, these plump endothelial cells, a nice mitotic figure right here. Another mix of inflammatory cells, some neutrophils scattered throughout. And then these vascular channels, these spaces are very filled with very few erythrocytes. It's mostly clear space, which is why this one is given the sort of vague title of angiosarcoma. So again, we have some free hemorrhage in the superficial dermis that was contributing to that sort of bluish, purplish, reddish appearance of the skin. And again, just this aggressive infiltration in and around and sort of strangulating the adnexal structures. These are some images from a different cat, but that also had the same diagnosis. So there is a little bit of variation in how these lesions can present. Sometimes they look like they've almost been run over, or it can look like bruising. They can have a somewhat gelatinous appearance to them, but they tend to be a moist and wet lesion. And so these are a little out of focus, but they biopsied as well. So I'm just going to show you biopsies from this case as well. And it's very similar. All this clear space, you might think, oh, just dilated lymphatics. But indeed, this is ventral abdominal angiosarcoma, probably again with some more pyoderma and thickening acanthosis of that remaining intact epidermis. Again, we're seeing that mix of inflammatories peppered throughout. Sometimes you'll see phagocytophages. We did see some erythrophagocytosis in that other case, so that makes perfect sense. And so that is the entity of feline ventral abdominal angiosarcoma. And I hope you enjoyed this case. I hope you found it useful. If there's other cases you'd like to see, please let me know. And I have some very exciting news that I want to share with you. The wonderful Dr. Susan Fogelson of Fishhead Labs has graciously agreed to be our guest presenter for DermPath Rounds next week. And she is going to present some scaly pathology. You've got to see these cases. They're going to be sensational. She is such a talented pathologist, and they're really going to be very special. It'll be a nice break from our typical mammalian, cat and dog pathology. So she's going to present a case from a lizard and then from a fish, and it'll be a lot of fun. So here's her contact information if you'd like to reach her. She's down in Florida, and she specializes in fish and lizards and turtles and and that is her niche. And she is very talented with that, although she does read other types of biopsies, and she does a lot of necropsy as well. And it's just a wealth of information. We are so excited and delighted that she's agreed to do this and looking forward to that next week. So we hope to see you there. Um, Again, if you have any questions or ever want to reach out or just say hello, share a case or submit any cases, you can always get in touch with me. I love making friends and saying hello, even though I'm at the scope most of the time. I do like connecting with people. So I hope you enjoyed this, and until next time, I hope you have a good week. Take care. All right.